I'm Lorraine L., CEO of Better Money Decisions. Joining me today with this webinar is Susan Coe, our Senior Wealth Advisor and Director of Financial Planning. Better Money Decisions is a 100% woman-led, fee-only financial planning and wealth management firm. We are dedicated to helping you live life to the fullest by making the most of your financial decisions. Today's webinar is one of an ongoing series of educational webinars to keep you up to date on topics important to your financial well-being. Today, we'll be discussing Medicare, what you need to know about your health and wealth. Before we begin, I want you to note that we do not sell insurance of any kind, so the advice in this webinar is purely educational. So let's start right in. Susan?
Great. Thanks, Lorraine. So we'll dive right into this topic. This is always a fun one. And we get this a lot with our clients that are approaching that magical age of 65. There's a lot of excitement that comes around with that because, your healthcare costs are going to go down generally when you start Medicare. But it's also a little confusing and scary. And so really the purpose of this webinar today is to take a high-level look at Medicare, explain what you need to be thinking about and looking at when you're making that decision. The problem that comes in with Medicare that we see with our clients, and really the reason that we're doing this webinar, is not only is it extremely confusing, there's a lot of choices, there's a lot of misinformation out there, but it's also extremely important as far as your holistic financial plan and making sure that you make that decision that's right for you. One of the reasons why it's so important and why we want our clients to spend a lot of time understanding and making the right choice here is, as you know, healthcare is extremely expensive, and that's not going away. In fact, when we create financial plans for clients, the base inflation we use for their just general costs, so housing, food, things like that, long-term inflation rate's about 2.5%. For healthcare, we're actually doubling that, more than doubling that, and healthcare is inflating at 5.3%. So what happens is this healthcare component of your overall financial plan just becomes more and more important and more expensive as time goes on. So that first initial decision, again, is really important. And that's why we're going to take the time to kind of walk you through that and give you some things to think about here along the way. Okay, so Lorraine is going to be digging deeper into each of these parts, but this is just high level to give you a feel for what Medicare looks like. So that Part A is generally free for most people, and it covers your healthcare or covers your hospital stay if you need that, limited nursing facility and hospice care. The Part B is your original Medicare. And that covers doctor's appointments, preventative services, things like that. Part C is where you're seeing the bundled plans and seeing commercials on TV. And then Part D is the prescription drug coverage. So Lorraine's going to take over here and give a little bit of her experience with each of these.
So, Part A, free. Yeah, you heard that right. If you or your spouse has worked 40 quarters, you're entitled to Medicare Part A for free. Part A basically covers the first 60 days of any hospital stay. And you should definitely take the opportunity to enroll in Part A at age 65, even if you receive your health insurance through work and are not yet taking Social Security. It's free. Why not enroll? Here's the problem. If you haven't worked 40 quarters, you or your spouse, then unfortunately it is not free. Currently, it costs about $278 a month if you worked between 7.5 and 10 years, and then it goes up to $505 a month if you have worked less than 7.5 years. So it's really important to understand where you fall as far as your work history is concerned, so that you can be sure to qualify for free Part A. And again, enroll as soon as you turn 65. We can go to the next slide. So, all of that is great, but the big decision is whether you choose Original Medicare or Medicare Advantage. And this is really where I want to do a deeper dive into each of these options so that you have a better understanding of which plan or which program will be right for you. So let's take a look at a comparison slide of the two. And we're going to start with Medicare Advantage, because whether you choose Original Medicare or Medicare Advantage, everyone pays for Part B insurance. But there are differences in the type and the direction you go after you enroll in Part B. So in general, Medicare Advantage plans are less expensive, but they come with certain restrictions. The doctors in the plans are often state specific, and they must be in a network that is approved by the insurance company. So coverage outside of your state of residence may be limited. Some specialists don't want to take Medicare Advantage, and so it could be that there are longer waits to see a specialist. Now, on the plus side, Advantage plans have minimal and sometimes even no additional premiums above the cost of Medicare Part B, but many plans require copays. Now, Medicare Advantage plans can also offer additional insurance that Medicare doesn't cover, such as vision, dental, or hearing. I think the basic advice we usually use with our clients is that, if you live in one place most of the year, travel infrequently, and have budgetary constraints, then Medicare Advantage plans may be your best option because they do tend to be less expensive. Original Medicare offers far more flexibility in your choice of doctors. You can basically go anywhere in the United States. Original Medicare, however, requires you to find additional supplemental insurance, such as because Part B only covers 80% of your healthcare costs. So that insurance is called Medigap insurance, and you'll pay monthly premiums for that insurance in addition to Medicare Part B. Now, conveniently, and just to make it more confusing, Medigap plans are organized again by letter names: A, B, C, D, F, G, K, L, M, and N. So Medigap plans with the most comprehensive coverage can also have the highest premiums. Let's take Plan G, for example. Plan G doesn't cover the cost of the Part B deductible, which currently is $240, but after that, it covers 100% of the cost. So Plan G in the Medigap insurance world is considered the most comprehensive. It also covers 80% of medical costs overseas. So this is important because if you travel frequently or you have homes in different states, Original Medicare might be a better option for you. Here's something that's really important to note, and I think there's a lot of misunderstanding about this as well, that the coverage within each of the letter names A to N is identical. It's identical because Medicare mandates that it be identical, no matter which insurance company you choose. So in other words, coverage in Plan G, whether with Cigna or United Healthcare or Mutual of Omaha or any of the other ones, is the same. What differs is the cost of the premiums, the cost increases, which do come and are usually age-related, and also the discounts that individual insurance companies may offer within the different plans. If you get nothing else out of this webinar today but this, please understand that I highly recommend that you use an independent insurance agent. And remember, this is an independent agent. That's an insurance agent who can work with a number of different insurance companies and really has an understanding of the value of the different companies across all of the different letter names. But you need that insurance agent who understands the various plans in making this decision. Trying to go this alone, trying to figure this out on your own. First of all, it's not cheaper. if you go on the internet and find a Medigap insurance plan, it's not going to be cheaper than if you use an agent. So you're not saving any money. And it can really have a negative impact on your health and your finances into the future. So just to reiterate again, we don't sell insurance. So we're not saying this because we want your insurance business. But I just know that it would be much beneficial to you if you take the time to find a really good qualified agent who understands the different plans and what the different companies have to offer. The other thing involved if you choose Original Medicare is you really shouldn't just set it and forget it. It's worth checking your insurance every couple of years. My husband did this recently, and we moved him from one carrier insurance company to another, and we saved $80 a month on his premiums in his Medigap insurance just by changing. We didn't change plans. It was Plan G to Plan G, but it was a reduction in the cost of that insurance. So the other bit of advice for this is to always, check it, at least with the Medigap insurance, check it every couple of years. Now, the last of the main letter parts of Medicare, Medicare Part D, is actually the most recent, and that's for prescription drug insurance. Oh boy. So whether in Original Medicare or Medicare Advantage, Part D usually has some premiums that need to be paid. Although in Medicare Advantage plans, that premium may be rolled into the whole package and you may not see a separate charge for it. But definitely with Original Medicare, you're going to need supplemental Part D insurance. And this is, again, another situation where I recommend you don't just check this every couple of years, but you check your Part D insurance every year. These contracts for Part D supplemental insurance for your prescription drug plan is a yearly contract. And so not only do your maybe prescriptions change every year, your individual prescriptions, but the insurers change their formularies every year. So you might ask, what's a formulary? Some of you might be familiar with that because many insurance companies, while you're working or under age 65, also have formularies that you have to understand in order to get the right coverage. But a formulary is a list of drugs the insurance covers at the various levels. So, we all know that generic medications are usually cheaper than brand names, but also these formularies will divide different drugs into tiers. So tier 1 has the lowest copay, and it's most of the common prescription drugs. But it goes up to tier 2, tier 3, and then even a specialty tier, which is the highest copay, and those are for the very high cost prescription drugs. So these 1-year plans should be evaluated every year because the plan you have currently may not be to your advantage and the least expensive plan for your current drug needs. And so, again, that's where using a professional independent agent will really help you in making these critical decisions from year to year.
Yeah, another reason that we recommend that clients work with an independent insurance agent is they can actually look at your specific situation. So they can look at what medicine are you taking, what health conditions do you have, and make a recommendation on this as well. So I think it's really valuable.
It is valuable, Susan, because they really understand the underwriting. Now, that sounds like a technical term for insurance companies, and it is, but they understand what insurance companies will know about how much they'll charge in different age groups, and also, what advantage it's going to be into the future for you if you have some specific medical conditions. So, definitely want to work with a professional in that regard.
Yes, especially with how expensive it is.
Oh my gosh, it's not cheap.
Which segues to this slide.
So let's get into the cost a little bit. And some of you are familiar with these different categories of costs because no matter what kind of health insurance you have in the United States, there may be co-pays, there are premiums that you pay for the different insurance policies that you may have for health insurance, and Medicare plans are no different. And this is probably the biggest consideration in choosing which type of Medicare you enroll in, because the costs are different. You know, as I said before, Medicare Advantage plans can tend to be a little less expensive than the original Medicare because you don't have an additional supplemental or Medigap policy that you need to purchase. But, you know, you can't let cost be the only consideration. If you travel a lot, if you live in two different places during the year, as many retirees do, you may need to have the original Medicare plan because the Medicare Advantage plan may not be able to meet your needs if you're traveling around. And if you have major health issues that need specialist care, it may be critical to have the opportunity for accessing those specialists in a kind of an easier way than if you have a medical advantage plans. So some plans have deductibles, some have co-pays, and you know, many of them have a standard out-of-pocket maximum, after which any additional healthcare needs are covered 100%. So, you know, these are the kinds of costs that you need to pay attention to because healthcare is not inexpensive in the United States. It does cost a lot, and you want to make sure that you have the coverage that's going to meet your needs.
Mm-hmm.
So, Susan, let's talk a little more about these costs because it doesn't end there.
No, unfortunately, it doesn't end there. And this is a topic that I think sometimes gets overlooked. So we wanted to include it and talk a little bit more about it. So you've probably heard of IRMA, and that stands for Income Related Monthly Adjustment Amount. That started back in 2007 and is basically a way for Medicare to get more revenue by charging premiums based on your income. So it's really important to consider this for a few reasons. One, it can be substantial, as you can see here, as far as the adjusted amount, but also it's kind of a steep curve. So the numbers are based on 2 years prior to you reaching age 65. So those that are 63 sometimes are still working and may not realize that their income today is what they're going to have to pay at 65 for Medicare. So let's just take a look at the numbers here. So if you're single and you're under 103,000, you don't have any additional amount that you're paying for Medicare. You're paying the 174 and some change a month. If that were to go up less than 30,000 to 129, you're now doubling your monthly premium for Medicare. And this is coming out of your Social Security check. So it's something that a lot of times you do have some control over. You want to be careful about, your Roth conversion strategy. You want to be careful about taking any large capital gains. I actually had a client last year that had sold some farmland. They're generally not in a higher tax bracket. They sold a large amount of farmland, which impacted their Social Security, and they ended up paying substantial premiums for Medicare each month that came out of their Social Security check, and was problematic for them. Now, another thing to consider is you actually can appeal the amount. So let's say you had some sort of life event, maybe death, divorce, something like that where your income really has substantially changed. There is a process to appeal this. In fact, if you are in this category where you're going to have a premium taken out of your Social Security check, Social Security will reach out to you and let you know. So you'll get a letter in the mail from them, and you do have an opportunity to appeal it. And so I would recommend looking into that. It's not hard to do. So yeah, you just want to be really careful about what you're doing with tax planning in those years leading up to Social Security. Know that even if you were to get into this higher premium situation, it is looked at each year, and so it would get adjusted again. But it still can be a large sum of money that you maybe didn't need to pay. So it's something to consider. And then same thing for Part D. Lower amount, so it's less of a concern, but the income also impacts your Part D, which is your drug coverage. So just another surcharge there that you want to keep in mind and consider.
Yeah, and Susan, I think something that we neglected to kind of mention earlier is that, if you are taking Social Security, these costs are deducted from your monthly Social Security check, or
Yep.
who gets a check anymore, I don't know, but monthly Social Security deposit into your bank account.
Right.
And if you're not, however, taking Social Security yet, because we have a lot of clients who delay taking their Social Security to even age 70, and full retirement age for many retirees now is age 66 or 67,
Mhm.
that you will have to write a check to the government to pay for those Part B and D premiums before you begin taking Social Security. So that's something also to keep in mind for the Social Security and how you cover the costs.
Yep, that's a good point.
Yeah, so let's look a little bit at enrollment periods. And this is really important information, and especially the initial enrollment, because if you miss that window, and the window when you first become eligible for Medicare is 3 months. You can apply 3 months prior to turning 65, and up to 3 months after you turn 65. That initial enrollment window is really important for you to hit, because if you miss it, it can cause penalties that last the rest of your life. So you don't want to mess this up. Now, there are folks who are still working and are still eligible to get health insurance from their employer. If that's the case, you may be able to defer enrolling in Medicare because you are already covered by an employer sponsored plan. But this is something you need to go to your HR department at your company and find out if you'll be covered through the company or through or need to apply for Medicare, because you don't want to miss this initial enrollment period. It's critically important. The annual period is that time between October 15th and December 7th, where we do recommend that you definitely check on a yearly basis your supplemental Part D insurance, but also every few years. You don't have to do it every year because those contracts don't change that frequently, but to check on your original Medicare or Medicare Advantage plans as well. And so it's important not to ignore these enrollment periods, because this is your opportunity to make the best financial decision you can about the cost of health insurance, which is really a big part of your budget when you get older. So it's important for you to understand these different periods so that you have an opportunity to get a plan that's going to work in your advantage. The other thing, and I think this is important to understand too, is that the insurer may not have to take you based on your health status. After your initial enrollment period, it may be that you have an illness that is very serious, and that when you try to change insurance companies, they do not have to actually take you on as a client. So when you originally apply, all insurers are obligated to take you despite what kind of health issues you may have. So, this is also another thing to think about. If you think that you do have a major health issue, you're going to want to try and get the best plan, thinking into the future and not just for today.
Yep. Another reason to put a lot of thought into that initial decision.
Absolutely. Absolutely, Susan.
Well, this is my favorite chart in the presentation because I think it shows what we do for clients. So it's our holistic approach. You can see the insurance pieces in there, and it's really important, but it's only one piece of the whole picture. So we also want to consider, looking at not only your investments and how they're positioned, rebalancing cash flow strategies. We talked a little bit about some of the tax strategies that can kind of play into the insurance. Estate planning is critically important, financial caretaking for some of our older clients and even our younger clients. And just making sure that you're on track to meet your goals. And so this is when we think about managing assets for a client or working with a client in any capacity, we're very careful to not just look at one piece of this, but really bring it all together. And I think that what we're finding with our clients is that this Medicare decision and healthcare in general is a huge part of their overall financial wellness and financial well-being going into the future. And so we wanted to spend some time talking about that today, but certainly don't want to neglect any of these other categories either.
So, as Susan just discussed, these financial decisions heading into retirement can really impact your future financial viability. And it's really important for you to kind of make these decisions holistically and take into consideration all of the different aspects of your financial life. Susan and I are available if you have any questions about the topics we discussed in this webinar. We're here for you. And we'd also like to know if you would like us to help you in achieving what we call financial wellness for life. Thanks very much for joining us today.
Thank you.